everybody. Well, Merry Christmas week, or whatever you want to call this. We're almost there for the holidays. All right, we got a lot of information. Let's get started. All right, vaccine, because I know that's the most pressing information on almost everybody's minds. And then I know the most second pressing bit of information are the testing trainings. All right, vaccines. We have resources here that include the CVS COVID resource page. This includes the consent form and the EUA that you can download if by any chance you haven't received your packet from CVS. To my knowledge, Walgreens doesn't have a similar page. I'm still searching for that and trying to get that from our contact. If we find that, we'll get that to you. I've included our contacts with CVS and Walgreens, and also a generic like immunize LTC at walgreens.com. You'll see it in this. Don't worry about jotting it down. You'll see it here in this alert or this update. Just so that if you need to reach out to anybody there at Walgreens or CVS, you can. We've learned with regard to your initial contact from the pharmacy, if your facility has not received a communication, that initial communication, email, and then a follow-up phone call from either Walgreens or CVS, please do the following. First, look back at that original vaccine survey that you remember your facility filled out. I think it was back in October, that was responding to the cabinet, and ensure that the same person that was listed as the contact person is the person who's checking their inbox for the notifications now. And then also check your email spam filters, trash boxes. If you still can't find any communications from CVS or Walgreens, please notify Wayne or myself, and we'll help you facilitate communications with the pharmacy, or feel free to reach out to the contacts listed here in this update. All right, we've learned that this is coming from the IG's office. Some facilities have been trying to change the dates of their clinics that have been set. Please remember that dates are set in stone. They cannot be changed. Please do not attempt to change the date with your pharmacy partner. That is going to cause, this is already a mass chaos process, and trying to, plan clinics around the country. So you cannot change the date of your clinic. All right, Moderna vaccine clinics are going to begin on the 28th of December, of course, depending on whether the emergency use authorization is granted, and also depending on which vaccines Kentucky receives. And we still don't know which mix of vaccines we'll get, or if we'll get a mix. With regard to communications, AHCA and KCAL released a new Get Vaccinated campaign to encourage long-term care staff and residents to get the vaccine. Take a look at that and see if you want to use any of those. There are template letters, and then social media posts, and just prep materials. So take a look at that and see if there's anything that you find useful. Consent forms. I know this is a hot topic. We've learned from AHCA that through their conversations with both Walgreens and CVS, that all forms of consent will be acceptable. However, there is an order of preference. So you would first try to get that pharmacy-generated consent form filled out. If you can't get that, then you would get a written consent form that would be attached to that pharmacy consent form. If you can't get written consent, then you'd get an email consent form attached to the pharmacy consent form. And then finally, the last resort is verbal consent. And you'd go through your normal verbal consent process at your facility, and then you'd document that in writing, just like you normally would, and attach that to that pharmacy-generated consent form that you get in your packet or you download from the internet. All right, facility approval. We know that in Kentucky, all but 9 facilities were matched with a pharmacy partner, and we know that the IG is working to ensure that those remaining 9 facilities are matched. And we'll be learning more, the association will be learning more about those 9 facilities. And if you are one of those 9, you'll be hearing from the IG here in the next few days. I know another hot topic and another big question, residents or staff who miss a dose or short stay residents. Last week, we did tell you that the Department for Public Health said that if a resident came to you all from the hospital, they would likely be vaccinated, get their first vaccine, or get one of the vaccines either prior to, or if they went to the hospital, they'd get another vaccine after leaving your facility. We've learned that is not accurate information. Hospitals haven't received, at this point, enough vaccine to complete that. So at this point, you all will be responsible for providing either the first, the second vaccine, and then as it stands right now, there is not a plan that we have received for ensuring that short stay residents or residents that come in on the second dose, or I'm sorry, on your second or third clinic, get their second dose. I hope that makes sense. So if you have questions about that, let me know. As soon as we receive any type of communication from the federal level on that, we'll let you know. All right, we've also found with regard to the COVID vaccine that if because we know that some facilities in Kentucky are already beginning to schedule clinics. So if you do have any adverse events that occur with the vaccine, we know that you are supposed to report those. And there's a reporting system, and I've included the link to that reporting system because they want to know about that. The federal government wants to know about that so that they can track all of that. And then we've also clarified that staff members under the age of 18 will not be vaccinated by the pharmacies for liability reasons. And they've suggested if you have some of these folks in your facilities doing, I guess CNA or helper type work, you can check with your local hospital to see if they may be vaccinating, healthcare workers, and they can slide them in as well. Or these folks may just have to wait for the general population to be vaccinated. All right, with regard to COVID vaccine questions, please reach out to us. And any of those questions, we can kind of filter them up to our contacts and then collect them and get these answers back out to you all instead of, individual questions going to CVS, Walgreens, and then not everybody knowing. So it's kind of helpful for them to come to us so that we can get those answers to everybody. All right, moving on to testing. It has been a big week for the testing program. Y'all know that because I know I saw a lot of you participated in the state's 2 trainings that they had this week. And I kind of put some information in here. Please consider a couple things as you think through and you think about this new state's testing plan. Per the cabinet, this testing plan is an attempt to assist you all as the federal funding for the state-supported testing plan runs out. So this is their attempt to help. And as they've said, any facility has the option not to utilize this program and to instead contract with a lab to complete any required for CMS certified facilities or preferred testing for PC or AL facilities. So you'll see a chart that I've inserted here. It's an attempt to help you determine if you're required to test at your facility, and if you are, how often, what your guidance is. Because I think, during the presentations, I realized there are even some basics I think that everybody's, it's like, wait a minute, let's go back to the beginning. So starting there, I've just kind of lined that out. And then I've included the actual guidance that the testing, not the actual guidance on the frequency, but the guidance on the testing program that came from the cabinet. So that is included here too. Also keep in mind, this is important because I think there was some confusion on this. The Binax Now ag cards are antigen tests similar to those PCR point of care tests, but this is different. These ag cards, they don't require a point of care device. So if you're a facility that does not have a point of care device, don't worry about it. You don't need one. These Binax Now ad cards will be sent to you by the state if you opt into this testing program. And everything you need except for your PPE is included in this packet that you get from them. As y'all know, the state held 2 webinars about this Binax Now program and the new guidance this week. We've gotten the preliminary slides from those webinars and I've included them here, but I will tell you that the final slide deck that will include that, I thought it was pretty handy, the chart regarding reporting, because I think that's one of the main points of confusion. And then also frequently asked questions are expected from the cabinet either tomorrow or Monday, and we'll be sending those out to you as soon as we get them. Probably they'll also be posted on the IG's website. So even though I wanted to get you these preliminary slides or these draft slides as soon as we had them, but please know that the final slide deck is going to have probably the most valuable information in it, and that'll be coming tomorrow or Monday. I did find a training video link for the Binax Now product and included that here. I think it's pretty valuable because even during the training that the state put on, I know on Monday I found it very helpful. On Wednesday, I didn't find it as helpful as Monday. So I just went ahead and included the training link, and that's on the actual product. So your folks that are, doing administering this test can take a look at that training video. All right. I also, during the actual trainings, we attempted to capture the Q&As. Even the state's going to do the same thing. They're going to include that in their slide presentation that, like I said, will be coming to you either tomorrow or Monday. But we attempted to kind of do the same thing. Just, duplicative information doesn't hurt, right? So that's attached here for you to review as well, just to kind of get you started on digesting this information. Like I said, more to follow from the cabinet. And if you have additional questions, please either contact, preferably us, and then I know Keith Knapp said that he would be the main contact on this, but if it comes through us, we can kind of gather those and then streamline, get those to the cabinet and then bring them back and let everybody know the answer so that, because I know a lot of the same questions are going through the cabinet. And then Betsy pointed out, for anybody wanting to advocate for long-term care, it's advised that you reach out to Leader McConnell's office to advocate for bipartisan support of the federal stimulus bill that will then enable states to continue the funding that, for instance, will allow for testing like we've had for staff and residents. So reach out to Leader McConnell's office if you have a spare minute. Department for Public Health did remind everybody that the SurveyMonkey tool you will still need to do, because this is where you report new cases and deaths. So that reporting should continue. Even though I know on Monday, during Monday's training, I think there was some mention that you would not have to continue SurveyMonkey. You do have to continue SurveyMonkey reporting. So I just want to make sure that that is clear and understood. Continue SurveyMonkey, because that is the information that goes to KDPH and IG with regard to new cases and deaths. And that ultimately is the information that goes to the governor's office for his press conferences. All right. We do know that on the 14th, this past week, just a couple days ago, that the Department for Public Health revised its travel guidance. And this doesn't directly have to do with long-term care, but we have, a lot of our staff members getting ready for the holidays. So the Department for Public Health revised its travel guidance to discourage all out-of-state leisure travel until further notice. So it's not a mandate, but it's just a discouragement of that travel. So just wanted you to know I've included that discouragement, or that kind of piece of not guidance, but so if you want to post that somewhere in your facility. And then also if people do engage in out-of-state leisure travel, they're urged to voluntarily self-quarantine for 14 days when they return to Kentucky. All right, in NHSN, we've already talked about, if you haven't received that level 3 access, you're supposed to be keeping proof of your attempts to obtain level 3. This is something new. If you are still unable to obtain level 3 access, please email both nhsn@cdc.com. That's included in this update, so you don't have to jot it down. And also Kevin Spicer, who's at the Department for Public Health. Even if you've already notified NHSN, he wants to know if you are having trouble. Basically, the state wants to know if you're having trouble, and it sounds like they're gonna compile a list on the state level of who is having trouble, and they're gonna try to help. We also know at the association level that AHCA is attempting to help the facilities in Kentucky that don't have level 3 access, try to get that access. So we're trying. I think there are multiple folks around trying to help you all get that access. And I do know that, and I think we'll talk about this in a second, I don't think that there will be strict oversight of that because there have been so many issues. All right, CDC. The CDC has issued a revised guidance on the recommended quarantine periods. I won't get into the specifics. You all can read through this, but just take a look. It's basically shortening the quarantine periods. This has been out for a little bit, so take a look, and you probably already know about this. All right, AHCA, they let us know that CDC is working on something in writing around, like I said, the enforcement of submitting that CLIA data. They and CMS are not looking to go out and cite. They understand it, that getting the access to level 3 in in uh, in HSN has been difficult. So they're going to be encouraging states to use enforcement discretion. So just keep that in mind. And if you happen to have an issue with that as surveys ramp back up, or you have somebody come into your facility, a surveyor, please, please, please let us know, and we will assist in any way we can. And finally, OSHA is not, and I think we've talked about this before, but I just want to remind everybody, OSHA is not considering KN95 masks adequate during their surveys unless you cannot obtain N95 masks. So if you're unable to obtain N95 masks, document your efforts to get them, and just make sure that you have that documentation available if OSHA surveyors come in. All right, that is it from me. I hope you all have wonderful holidays. Again, over the holidays, please let us know, reach out. We will be available by text, by phone, by email. We'll be checking, and enjoy your break. Thanks.